Government has promised that more vaccination sites will be added around the country. A new one is set to begin to operate in Gauteng today. That's at the Charlotte Maxeke Hospital here in Jozi. It's one of the 2 new sites in the province. eNCA reporter Mangoba Mkhunu is at the Charlotte Maxeke Hospital this morning. Good morning, Mangoba. Yet another site. I'm sure this is really good news and bringing much relief to healthcare workers who are still those who are in the first phase of this inoculation program.
Well, indeed, Badan, we are expecting those inoculations to resume here at the Charlotte Maxeke Hospital this morning. Of course, this is one of the 4 sites that have been identified by the province which will be carrying out the vaccination program for those healthcare workers, of course, who are in the front lines and who are being targeted for this particular phase of inoculations. And I can tell you, Badan, that there is quite a lot of excitement here at the hall behind me where these vaccinations are expected to resume at 10 o'clock this morning. And in terms of what we understand so far, according to the department, in terms of the breakdown of how many vaccine doses this particular site will be receiving, we do understand that Gauteng this time around will be receiving 18,400 doses of the Johnson & Johnson vaccine, and 8,520 of them will be sent out today, and the remainder of the 9,520 will be sent out on the 8th of March. And these vaccines have been earmarked for both public as well as private hospitals. We do understand that of these 8,520 vaccines, 6,500 of them will go to public facilities, and just over 2,000 will go to these private facilities, which include the Mill Park Hospital as well as Lenmed. But to speak further, Brian, on the logistics and I guess the mood here at the hospital, I'm now joined by the hospital CEO, Gladys Bohoshi. Mama, thank you for your time. Let's start here. In terms of readiness, how ready are you to carry out these vaccinations?
Good morning to you and good morning to the listeners. We are more than ready. We've been waiting for this day for so long. Today is really a special day for our frontline workers who fought this fight with professionalism, dignity, and all their efforts to make sure that we save lives.
Let's talk about the mood. I mean, we have spoken to healthcare workers. Of course, some of them were very excited about receiving this vaccine, but also there's quite a number of them who are saying that they're not taking this vaccine. I mean, what's the mood here at the hospital?
Generally speaking, the mood is a very good one. People are excited. Just to show how excited people are, we had more than 100 staff members who volunteered to be vaccinators. We have our labor, the leadership of the labor saying, CEO, vaccinate us first, so that we can show everybody that this vaccination is important. We have everybody, we have heads of departments, we have our staff here who are really, really excited. We are aware that there are people who still have some skeptics around the vaccine, but we have a program where we send SMSs to explain what the vaccine is all about. We have translated it into different languages so that everybody can understand what is this vaccine, how does it work, what are the little side effects that you might get, which is not that common.
Let's talk about this particular site. How many of those doses will you be getting, and how many staff do you have to administer those vaccines?
We have 109 vaccinators, as I have mentioned, but we have many volunteers who are mending different stations. Johnson & Johnson is going to send us vaccines on a weekly basis. For this week, they've sent us around 3,600, which we have to start today and finish it by Saturday. Then next week, we will get another set of about 3,200 to vaccinate the second batch of our staff and the cluster hospitals. And then after that, we will get doses on a weekly basis.
Let's talk about, we do understand that the first patient who contracted COVID-19 will be here at the Charlotte Maxeke Hospital this morning. What's your sense? How are you feeling?
The patient is already here. He's on stage, she's on stage listening to all the speeches. She's here to really thank the health workers who were the first in the public sector to receive a patient. They had only 2 hours to prepare to have her in a bed, and they did it with military precision. The patient was in the ward, was discharged, and she is still very grateful that she came to our hospital.
Okay, thank you, Mal. That's Gladys Bukhoshi, who's the CEO here at Charlotte Maxeke, just giving us a picture exactly of how that vaccination program will resume this morning, and saying that they are, in fact, ready to continue with inoculations.
Thank you very much, Mangoba Mkhunu at the Charlotte Maxeke Hospital in Johannesburg. Another additional COVID-19 Johnson & Johnson vaccine site that's been opened today in Gauteng.